In medical coding, especially the coders who are working with same-day surgery, emergency department, denials, anesthesia and pain management coding, we will use two terms frequently, which are CPT and HCPCS. Even though these two terms sound similar, but as a coder, we need to understand the differences between this CPT as well as HCPCS. The full form of CPT is Current Procedural Terminology. The full form of HCPCS is Healthcare Common Procedural Coding System. Most of the time, we will use CPT for medical procedures or services. Most of the time, you will use HCPCS for supplies. Even though we will use these two terms in coding, but the structure of these two terms is very different. So, if you want to know the complete difference between CPT and HCPCS, please watch this video until the end. And also, if you like this session, please click on like button in order to motivate me and provide more valuable videos like this. If anyone looking for free AAPC CU webinar links, medical coding jobs in India, USA and UAE, please join in our WhatsApp group. The group link is in the description of this video. First, we will see few differences between CPT as well as HCPCS. These are the foundations we need to understand in order to use these codes properly. Mostly, we will use CPT codes for medical, surgical and diagnostic services performed by healthcare professionals. And these CPT codes are owned by AMA, otherwise American Medical Association. CPT codes acts as a critical component of the healthcare industry where these codes will provide uniform language for coding medical services and procedures. Usually the CPT code is having 5 numeric digits categorized based on procedures and services. Again, these CPT codes are divided into 3 categories: Category 1, Category 2 and Category 3. Category 1 includes most commonly used CPT codes which we will be used for healthcare services and procedures performed by the physician. And again, Category 1 divides into 6 sections: Evaluation Management, Anesthesia, Surgery, Radiology, Pathology, Laboratory and Medicine. Now we will learn about HCPCS codes, expanding beyond CPT. Most of the time, CPT codes are having the more priority than HCPCS codes. These HCPCS codes will expand beyond CPT. So what is the purpose of HCPCS code? Most of the time, we will use CPT HCPCS codes for procedures, supplies and services to Medicare, Medicaid and other health insurance programs. So basically, these HCPCS codes are based on client requirement. These HCPCS codes will be managed by CMS and these codes will be available on public domain, whereas CPT codes are not available on public domain. So in HCPCS, we are having 3 level codes. So level 1 is original CPT codes. Level 2 codes cover a wide range of procedures and services, including products, supplies and services not covered by CPT codes. So we are having level 3 codes also, but these level 3 codes will be not used by nationally. These are related to local insurance. Mostly we will use level 1 CPT codes for hospital providers, level 2 HCPCS codes for hospitals, physicians and other healthcare professionals who will bill insurance. Usually we will call them as QHPs. So level 3 HCPCS codes are local regional codes. They have discontinued in 2023. So why understanding the difference is essential? So in order to code accurately, understanding the difference between CPT and HCPCS is very essential. For example, if you are coding for any type of supply, you need to use HCPCS code. You can't use CPT code. So here, if you know the difference between CPT and HCPCS, you can't waste your time and you are able to code fast and accurately. For example, if you want to code for any type of surgery, you will not get those surgery CPT code in HCPCS codes. So if you know the difference between CPT and HCPCS and its purpose, you can code very fast and with